Hi, welcome to the new season. Today we're going to be talking about our doctor's favourite treatments. Yeah.
That was good.
That's good. Hi guys, welcome back to the channel. A question that we get asked really often is, what are your favourite treatments to do for patients and why? So this new season is all about discussing with my guys, my boys here, topics and stuff that we get asked about all the time, because it's always interesting to see what other people's opinion is, because if you ask like 10 different aesthetic doctors what they would do, for example, for a patient, you'll get 10 different answers. Over to you first, Euan. What is your favourite treatment and why?
One of the treatments I get asked for on a daily basis at the clinic is about jawline, because it seems like one of the current trends. I don't know about you guys in your clinics, but for me, my patients are always asking, how can I get a more defined jawline? So men and women both want jawline treated. What do we do? Usually it's filler. But it doesn't have to be just filler. Sometimes we'll work with the fat, dissolving fat, getting the jawline ready for the filler.
Masseter as well.
Yeah. So if a lady, for example, is quite square, usually it's women that want this done. They'll want it slimmed down. Some men do, usually ladies. But once we've got the jawline prepared by dissolving fat, usually in the gel area, and slimming the masters if need be, then we'll fill. I don't know what products you like to use, but I certainly like the HAs, like Volux, and I like Radiesse. I don't know what your thoughts are on them.
Okay, well, I'm just going to jump in there. Actually, I'm using a lot more Volux than I am the Radiesse at the moment. I don't know what it is, but I think in my hands at least, I feel like I can get a crisper look using the Volux, but you know, I think the Radiesse has definitely still got a place.
So I definitely use more Volux. So Volux is a hyaluronic acid filler. It's much stronger than the fillers that you'd maybe put in your lips or under your eyes. For obvious reasons, you need that structure. And you get really nice results. And now that those hyaluronic acids are stiffer than they used to be, because they're quite new generations, we get results that last just as long as older fillers like Radiesse. Radiesse isn't a hyaluronic acid filler, as you know. It's more of a collagen stimulator. It does give really nice results as well, but I'm kind of not using as much as I used to since the Volux came out, I agree.
I just want to jump in there as well and talk about lateralization of the jaw. So if somebody's got really bulky masseters and you're looking at them from the front, that's like the first thing that you see. Like, you can't see all the way back to the angle of the jaw, but if you're like looking at someone like Angelina Jolie, for example, you can see almost all the way back to the angle of her jaw looking at her from the front. So you got to slim the front part of the face first before you can do the jawline in order to create the best kind of result.
Exactly.
Yeah. I agree. I mean, I agree with the Volux as well. I think that's it's not just crisp, it's really robust, it's really long lasting. And having had the treatment myself with you guys, I can vouch for it really does last the distance, and better than anything I've actually used before or even tried on myself before.
Because I had it done with older generation fillers to begin with, like Voluma. It just wasn't like giving what you needed. It was kind of getting lost in the tissues a bit. It was a bit better, but because they're more robust and stronger now, you definitely get a much crisper look. I think I agree with the lateralization of the jaw. You've got to also be careful looking at your patient. You don't want to square, for example, a woman off. You don't want to be too wide. That's a big fear that my female patients have.
I think that's a really big crime on Instagram as well.
Huge
at the
Instagram
moment, isn't it?
crime.
Rhomboid head.
So I don't know if you guys have seen, but on Instagram you'll see a lot of these like really structured jawlines from the side. They look like almost insane, and like they look good. I get people asking, how do I get that definition? You haven't seen these people from the front. It does not look good from the front really because they're really wide.
And in real life as well.
They're almost made for Instagram, aren't
Yeah,
they, those
it's really
pictures?
true.
They're not made for real life, and that's what we've got to remember.
Yeah, you just look like a weirdo in real life.
Yeah.
No. Let's talk about the pain and the downtime.
Okay, so I actually don't think, having had it done myself and plenty of patients, I don't think it's that uncomfortable. I usually will use a cannula, which, if you guys have probably seen from the channel before, is a blunt instrument. You make one small entry point and then you thread the cannula into the skin. It sounds gross and it looks quite gross as well. However, in real life, it doesn't hurt. It just feels really odd. Sometimes we'll use some needles. If we need to widen the jaw, we can do some deeper fillers onto bone to widen the jaw. And sometimes we'll use needles around the chin to bring the chin forward, for example. But on the whole, it's usually a cannula. And I would maybe rate it, for me, 2 out of 10.
Okay. He's
I'm
strong.
going to say it's quite gentle. I mean, like, having had it done, doing it for patients, all the feedback I get is that it's really gentle.
Yeah.
And I think, you can use a needle, but I think the cannula is almost like, for me, it's like a paintbrush. And you can sharpen, you can soften, you can do what you want with it, but it is dependent on how you use it.
It sounds icky though, doesn't it? Because you can kind of hear the...
Yeah, maybe it feels a bit like weird, that's all. But pain? No.
Yeah.
It's not bad.
Okay, well, you're pretty hardcore.
Yeah.
In terms of downtime then...
So I usually find that people will have a little bit of swelling, not too much. Actually, you need to use quite a lot of product to get a really crisp jawline with a big change. So normally people start quite conservative with just like 3, maybe 4 syringes. And they get a bit of swelling, and the swelling actually looks really good because it makes the jawline a little bit more defined, and then the swelling goes down and they're like, oh, where's the product gone? And actually you need just a little bit more product. So realistically, 4 syringes for a good jawline, if you consider the amount you're going to have to cover the distance, it's not a lot of product.
I'd say that was a minimum.
Yeah.
It's
That's
like
what I mean.
minimum.
It's less than a tablespoon, really.
Yeah.
It's a minimum. But you can get some really nice results, and you can build them in time as well. You don't have to go all gland spacing straight away. You can come back for a review if you want it topped up. There's no harm in topping up at that point.
Okay, that's cool. All right.
What about pain? I was just going to say, I don't know if we should mention this or not, but this is the only treatment I've had, pain on the evening of the treatment. When the anaesthetic wears off, I don't know what happens, maybe it's the chewing, or maybe it's whatever you do after the treatment. I found it quite painful.
So once I had my chin done, and I got numbness from pressure on my mental foramen because I had so much product in the chin. I mean, it looked amazing. It was really good, but I was numb for a couple of days.
The chins hurt.
Yeah.
I think that's something we warn all patients about, is after you have your chin done, it will be a bit uncomfortable. It's quite a tight space there, and for any degree of swelling, it puts quite a lot of pressure on the tissues, and that's probably why you got numbness from compression on the nerve. I had a little bit of kind of slurred speech for a day or two, just when it was a little bit swollen, but it all settles down and comes back to normal. It's not really anything to worry about, as long as we warn our patients in advance that could happen.
Could happen.
Which is what we're doing.
Okay, Dr. Kishan.
So the one treatment consistently I'm doing pretty much every day is the under eye area. And I think rather than sort of anti-aging people or turning back the clock, this is one treatment that just seems to make people look a lot more awake. And I also use a cannula as well, just underneath the eye. Sometimes I'll use a needle, but I think there's so many different products we can use now. So there's products like skin boosters. We've got Vital Light, Sunekos, we've got even Redensity 1, which I think you use quite a lot.
I do like that.
Yeah. And then in addition to the HA component to the products, you've also got things like amino acids, antioxidants like glutathione, and I'll just select whichever product suits the patient the best. And I think this is the treatment that people walk out with and they think, wow, I look awake.
First of all, I would like to say thank you so much for enjoying doing under the eye, because I detest it. So thank you.
Bring them on.
How do you decide which product you're going to use for which person?
So it depends on what they tell me. I think sometimes the patient will just give you the present of telling you, I don't want anything outlandish, I don't want anything overly corrective, or they want a result. So I'll just select it based on what they tell me.
Let's be specific. These guys at home want specifics.
Okay, so if someone doesn't want a huge change and they want something that's a gradual, a slow burn, and something that's additive, then I will recommend something very soft, like Redensity 1, that's going to regenerate the skin tissues, that's going to bring very, very subtle volume to the area, but also feed the skin cells as well. Somewhere between that and a normal sort of volumizing soft filler like the skin boosters, we're injecting Sunekos now, which in addition to HA also infuses the skin cells with amino acids, and that regenerates collagen and elastin in that really delicate area. And then finally I'll use something like Vital Light in the infraorbital region or under eye region with a cannula, and that gives a really nice little lift, and it's immediate, so patients walk out with that lift.
I'd just like to tell everybody as well at home that we all had Sunicos 1 week ago under the eye.
That's why we look so amazing.
And on top of doing the Vital, what about using Redensity 2?
So I really like using Redensity 2 in the right patient. If we've got a really visible hollow or a tear trough that extends all the way to the external limit of the eye socket, then I'll use something like Redensity 2. But these days I find that it's not as necessary as I used to when I started doing treatments.
Why?
Just the soft result that you get with something like a skin booster is enough. I think it's just how you do it.
I think you're right in the sense that lots of people have come into the clinic before with results that aren't nice from tear trough because they think, I look tired on the eyes. They go and see someone, they get filler in their tear trough because it was kind of a trend, but they weren't really addressing the underlying problem. That's where people tend to go wrong, isn't it, with tear trough, in that maybe their mid-face needed revolumization first, or maybe their problem wasn't because they were hollow, it was pigmentation or vascular show through the thin skin. So they've had incorrectly placed tear trough product, and then it looks weird, looks bulky
Speed bump.
and it's horrible. So you've got to choose the right patient.
And that can even come sometime later. So sometimes you see these like quite nice images which are done before and after on the same day of somebody that's had treatment here. But then often if you see that person sort of 3 or 4 months later, the hyaluronic acids absorb a lot of water and it looks like a big bump underneath the skin. So you always have to undercorrect significantly when you're treating that region. So it's a bit underwhelming at first. You know, you show somebody in the mirror and they're like, ugh. Looks the same, but it's supposed to, because what we're trying to avoid is it looking too puffy there. Also, did you mention mesotherapy as well, like with the light eyes?
So I love the light eyes, and in fact that's a game changer as far as I'm concerned, because it is like a vitamin cocktail for the eyes. Like, you know, people used to have the IV infusions. I mean, transmit that to an eye treatment that is regenerative. It's very rich in vitamin C, as well as some uncross-linked hyaluronic acid and bilberry extract as well. So this is unique because you have to have about 4 sessions of treatment, about 2 weeks apart, and the eye area and the pigmentation seems to soften. The area becomes a lot sort of lighter, and also you just look more awake.
You get some tissue contraction as well.
So puffiness settles, and even patients who've got what appears to be fat sitting in an eye bag underneath the eye, that seems to improve as well.
Do you guys want to know my Instagram bugbear?
Go on.
With tear troughs?
What is it?
It's when even these like big clinics, I shouldn't name anyone, I'm not going to.
Later.
Off camera.
Yeah.
But they do these pictures where like the patient's looking up for their
yeah.
pre-op thing, and then the fat bulges out and it looks really, really bad, and then the after pictures, the eyes are looking forward. So if you look up, if you've got any fat bulging from beneath your eye, it's going to pop out.
Of course.
And it looks so bad. And then their after pictures are looking forward and they suddenly look amazing. It's so
like, oh my god, amazing result! No, it's just positioning. Yeah, it's
anyway,
really annoying.
I had to get that off my chest.
Yeah, you are the king of like clinical photography, aren't you? I mean,
I do like good photos.
He's always moaning
good.
about it whenever we go to a conference or something. It's
In
like,
a
it's all I'll
constructive
hear
way.
just in my ear. Like, look, those photos are terrible.
I just take good photos, I don't know.
Oh, what about downtime?
So because the area is quite vascular and the skin is thin as well, you can expect sometimes to get a bit of a bruise. Many of my patients don't, but it's just I warn them beforehand that, yes, be prepared maybe with some sunglasses, be ready to wear some slightly heavier makeup to cover any bruising, and be prepared for a bit of swelling. I mean, the swelling is usually quite temporary, I think maybe a day or two. But the bruising could last maybe up to a week. But, you know, most people are quite happy to wear a little bit of concealer or something. I mean, I'm wearing some now because of some treatment I had, so you can barely see it now.
Okay, last but not least, me.
What do you
I don't, do you know what? This was really hard because Euan got a good one with the jawline. Okay, I'm going to say something which is not really just one treatment on its own, so sorry, that's a bit of a cop-out. But I really like doing V-line treatments, so where you're taking someone who's maybe got a bit of a square face and making the face look a lot more feminine. So adding volume in the temples, in the cheeks, in the anterior cheek, and in the chin.
All of them.
Yeah, I know.
Exactly. It's like the whole face.
It's my
we
channel.
selected, yeah.
I can say what I like. But that's why, because it gives a lot more delicacy to the face. as opposed... Shut up!
Just took an
Every
single treatment you do.
We talked about this beforehand about who was going to pick what, and I just couldn't decide. So in the end, I just had to
taking
take
it
all.
Take on.
So when you inject the temple region, do you guys? You're obviously doing that a lot. You're loving it. You're hating it.
Love temples.
Loving it.
Yeah.
Love temples.
Loving it. So you inject here, it gives you a little bit of lifting of the cheek area. Sometimes it takes your eyebrow up as well slightly and just changes the shape of the face, which is quite nice. And then we're doing the lateral part of the cheek here for lifting. Normally I'll do that with a cannula these days. You guys doing that with a cannula, with a needle?
Yeah, both.
Yeah.
And then the anterior section of the cheek here, just to give a bit more volume there, because a lot of people have lost the mid-face volume. And then I like doing the chin as well, just to extend that down, treat the chin crease, treat the tip of the chin. And I think if somebody's maybe wanting to do more full facial restructuring, but they don't want to do, a huge number of syringes, you can do all that with 4 mils, like for a subtle sort of result. Yeah.
I think this point you made about temples is my favourite thing is the reaction, because you'll say to patients, I'm going to start with your temples, and they're like, okay.
Yeah.
And when they see it, they're like,
Wow.
Wow.
Temple. And it's not one they ever thought about having done before.
Exactly.
No one comes in usually and says, unless they're educated and have watched our channel or something like that, they'll never be like, treat my temple. It's always, do my lips.
Yeah.
But
Yeah.
you point out the temple, you do the temple, and the reaction, like you say, is huge.
Huge. In terms of pain and downtime, I think we touched on this earlier. With temple injections, sometimes you can have a little bit of pain on chewing afterwards, but
I've had that.
there's not really anything significant normally to see.
No.
Cheeks, okay, you can be a tiny bit swollen there, and I think people's response to that can be variable. So
I think, that film Maleficent?
yeah,
If you use a cannula on the cheeks, you do get like quite a strong look for a few days.
strong look.
Strong look. But it goes, but you just have worn them.
Yeah. It always goes. And then in the chin, it can feel a little bit tight for a few days afterwards. But, you can't make an omelette without breaking some eggs, can you? And I think that gives a really nice soft result. I'm just going to cheat and just say one more thing.
Wow.
I know, I'm going to... Sorry.
it really is your channel.
So something that I'm really loving doing right now is putting 0.5 ml of the Bellatero contour into the lip on patients who maybe don't want to have any kind of lip filler, but are just losing a tiny bit of volume and they're starting to get the vertical lines in there.
Yeah.
Because it really doesn't really change a huge amount, but it just makes the skin really well hydrated there. So, yeah.
Do you ever still do that technique with the lip border? Do you remember the little microboluses?
Yeah, sometimes, not as much. And I think that's because I'm using a lot more of the Bellatero now in the lip. It's just, my preference currently
And
to do
are
that.
you using it with a the pen, the automatic pen?
No.
You tried it?
Which one?
The Teoxane pen?
Yeah, I've got 2.
Yeah. So have you tried Bellatero in there?
No, I haven't. But it's so soft.
Mm.
I
Not
don't feel
soft
like,
and
I
no
don't feel like you need
lumps.
to.
Yeah.
It's quicker. Get it in and out.
Yeah.
No messing around.
It
Quick.
is lovely.
Is that everything?
I think I'll just wrap things up. So my favourite treatment, to summarise,
Is everything.
Full facial treatment with temples, forehead, nose, cheeks, jawline, lips, tighten your neck, machines, thread, and Botox.
And your bum as well.
And, yeah,
It's in your
body
butt lift,
contouring.
don't forget.
Okay, that's great. So that's all we've got time for this week. I feel that was like about half an hour, but hopefully you guys enjoyed it. If you have any questions or comments, let us know in the down section below. We will see you again next week. Ta-ra.